views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello everyone, I'm Chris Mastromano. I'm the CEO of both Jacoby and North Central Bronx Hospitals. I have the pleasure of kicking off our first virtual health fair. And today we have a very special program for you all, highlighting and touching on a few subjects that are probably on the top of everyone's minds in our communities. You will have a chance to have an interactive chat with medical professionals, elected officials, and some Department of Education personnel. You will also have an opportunity to win some prizes and giveaways for you and the family. We're so grateful to our sponsors for providing iPads, Kindles, some laptops, and even bicycles that are going to be raffled off a little bit later today. We have a very special thank you to our community leaders and elected officials who are joining us remotely. I'd like to welcome our patients and community members from Jacoby and North Central that logged in and are joining us today. We're here to serve you, and it's an honor and pleasure to do so. One of the highlights of starting off this fantastic event is that I get to introduce our two wonderful presenters that will be hosting this. Damaris Diaz from Univision and Gary Axelbank from BronxNet. Welcome.
Well, thank you so much, Mr. Mastromano. And hey, saying a nice hello to Damaris Diaz from Univision. Nice to see you today. We have a lot to do. First of all, how are you today?
I'm so excited to be here, Gary. This pandemic has changed our lives in so many ways, including having health fairs for our community. So this is our way to make that happen for our community with this virtual health fair. Y le damos la bienvenida a todas las personas que se unen a nosotros en el día de hoy, que solo hablan español. Yo estaré aquí para guiarlos por todo este proceso, para que se lleven toda la información tan valiosa que tenemos para darles en el día de hoy y para que formen parte de esta plataforma, esta conversación tan importante y tan crucial en estos momentos.
What I'm really excited about for today is, you know, the people of the Bronx are touchy-feely people. We like people. We are people. And we've been hit very hard. Listen, we know what our comorbidities are. I mean, that's a matter of public record. But the people of the Bronx have such spirit and such fight that in the middle of the worst pandemic, and listen, you don't want to list all the problems that we've all had. The people of the Bronx, I see it every single day when I walk down the block. We're just doing our thing. We're wearing our masks. We're staying as distant as possible. We're polite to each other in the stores. And really for a back to school, is it safe event, now we need to have questions answered, because nothing more important in the BX than families and children. And I know you agree with me.
Absolutely. The Bronx community, like you said, it's a community that embraces itself and each other. Y es tan importante en estos momentos hablar de lo que significa esto, la reapertura de la ciudad, las fases que hemos estado viendo, los negocios se han abierto, las escuelas que están abriendo, y qué significa eso para nosotros como comunidad que estamos tan acostumbrados a darnos un abrazo, a extendernos una mano, y en estos momentos tenemos que encontrar la manera de conectar con la distancia.
And, you know, I do want to mention to people that not only will there be information, and goodness knows we need real information, and there will also be elected officials and public officials and healthcare professionals to provide information, but there will be prizes, and goodness knows it'll be for fun, and it'll also be for things that you could use. Now, I'm going to list some of the prizes. And hold your breath, please, ladies and gentlemen. Apple iPads, Kindles, tablets, bikes, Samsung Galaxy tablets, HP Chromebooks, Fires with Alexa, and people can register for those prizes. Now, as I understand, and this speaks right to my friends and neighbors in the Bronx, if you want to talk, and who doesn't want to talk in the Bronx, if you want to talk, if you want to chat, if you want to ask questions, if you want to share, the people who do that will get a better opportunity to win those prizes. And so that's just another way of engaging all of the people of the Bronx. So Damaris, do any I don't want to say last words, but any last words?
I definitely want to share that with our audience for the people that are not fluent in English, is that le vamos a dar la oportunidad de participar en esta rifa para ganar premios que buenísimos. Tenemos bicicletas, Kindles, iPads, así que tienen que registrarse. Le vamos a estar dando información mientras vamos desarrollando estos temas con algunos oficiales de nuestra comunidad que estarán uniéndose a esta conversación, y también, tan importante, los médicos que nos van a dar información sumamente valiosa, pero queremos que ustedes, cada uno, estén interactuando con nosotros, que formen parte de esta conversación y que no pierdan la oportunidad de ganarse estos premios que están buenísimos.
And what I do want to mention for the general public, this is not like for pretend. This is for real. If you have questions, then use the chat function of this program, because we'll have many elected officials and people from the DOE. I mean, it's very important. With school, I mean, is so important. So make sure you do that. Damaris, why don't you say that in Spanish, and then we're going to throw it to our first video.
I already did.
Oh, okay.
Le voy a enseñar a Gary a hablar español de aquí a que terminemos en el día de hoy. Right, Gary? We're going to learn a little bit more Spanish between now and the time we finish.
I really did not do well in high school. And don't blame my friends at Clinton, but that's how it turned out. Nonetheless, we really have a wonderful program ahead for you. So let's just get started off. Dr. Daniel Barayas, who is the Director of Women's Health at North Central Bronx, and also Adriano Espiat, the Congressman, and Senator Alessandra Biaggi are going to join us. I do want to do one more thing before we do that. We need to, because I didn't mention it at the top, we need to thank our friends at Jacobi Hospital, at North Central Bronx Hospital, and the New York City Health and Hospitals Corporation, because this was their brainchild. Rather than just read it in the newspaper or see it on TV with either Damaris or me, they're really saying we got to reach out and talk to families. So without further, did you want to say that in Spanish?
No, how special it is for us to be able to have their attention. You know, these are times when they're working harder than ever, and for them to take the time to organize this for our community and to talk to us directly through this platform is just a blessing.
Yeah, and it's also a blessing you and I get to work together for the first time. So nonetheless, let's do that. Dr. Daniel Barayas, Director of Women's Health at NCB. Let's take a look.
Hi, this is Congressman Adriano Espaillat, and I want to thank New York City's Health and Hospitals for the first time sponsoring an all-virtual back-to-school health fair. This is so important for families and children across the city of New York, and you continue to make sure that they understand that they must eat right, that they must follow the protocol to ensure that everybody's healthy. And during this COVID-19 pandemic, you have led the way in teaching our children how to move forward healthy and safely. Thank you so much for this health fair.
Our providers are committed to excellence in healthcare. We will work together to provide a comprehensive and personalized care to all New Yorkers, regardless of the ability to pay. We have a variety of services. Let's just start with pediatrics. We have a pediatric outpatient clinic from generalists to subspecialties. These clinics are connected to a 24/7 emergency room pediatric, where we will take care of your child's acute needs. And right before you go home, one of the providers will give you a referral to our clinics, and you will be seen within a few days. Also, we have a state-of-the-art community test center. We have been tested over 14,000 COVID patients and having results within few days. Also, while you're in the test center, we can provide the flu vaccine. I'm proud to say that North Central Bronx Hospital has been awarded the Golden Award by the American Heart Association for the high quality services provided to the patient with heart failure. But also we see other services, chronic hypertension, diabetes, and HIV. Women's health is another services that we have. We treat patients with a low risk and high risk pregnancies. we have an MFM group and ultrasound available to you. And a non-pregnant woman, we have services to treat any of the conditions that affect the woman's life. We have a state-of-art equipment to treat patients minimal invasive. They are far better than traditional surgery. Orthopedics and sport medicine. The sport medicine will work with you to improve your athletic performance, prevent injury, and if any injury occurred, will treat you for fast recovery and return to your activities. The orthopedic services will treat your joint condition with a state-of-art in a minimal invasive way. Nuestros enfermeras y doctores están comprometidos para darte un tratamiento de alta excelencia. Trabajaremos contigo para ofrecerte un tratamiento personalizado, independiente de la manera que puedas pagarla o no. Ofrecemos varios servicios. Empecemos con los servicios pediátricos. Tenemos unas clínicas pediatras en la cual tratamos las condiciones comunes de los niños, que van desde un general hasta áreas subespecializadas. Estas clínicas están conectadas con un servicio de emergencia disponibles para ti las 24 horas del día, los 7 días de la semana. Y una vez que seas tratado en esta emergencia, serás referida a una de nuestras clínicas y vas a ver vistas en los próximos 2 días. También quiero informarte que tenemos un centro de pruebas de alta tecnología donde hemos hecho más de 14,000 pruebas a pacientes por COVID y los resultados están disponibles en pocos días para ti. También, mientras tú estás en este centro de pruebas, te podemos dar la vacuna de la influenza. También ofrecemos otros servicios a los adultos como la diabetes, la hipertensión y el HIV. Tenemos servicios para las mujeres, en la cual ofrecemos servicios a mujeres embarazadas, de bajo riesgo, de alto riesgo, y también tenemos doctores del alto riesgo obstétrico, en la cual van a estar disponibles para ti en cualquier momento. Y a las mujeres no embarazadas tratamos las condiciones más comunes de las mujeres que pueden afectar su vida. Tenemos alta tecnología para realizar cirugías de la manera mínima invasiva, en la cual puedas retornar a tu trabajo de manera rápida y segura. Ofrecemos también servicios de ortopedia y medicina del deporte. El doctor de la medicina del deporte trata a los atletas para prevenir lesiones y si la lesión ocurrió, para tratar estas lesiones para que pueda recuperarse a sus actividades más rápido. Estos también servicios están disponibles para cualquier paciente, no solo son para atletas. El servicio de ortopedia tratará todos tus problemas de las articulaciones de una manera de la cirugía mínima invasiva con todo el equipo de alta tecnología que nosotros contamos.
Hello, Bronx families. This is State Senator Alessandra Biaggi representing the 34th District, and it's an honor, as always, to welcome you into the new school year. I could truly not be prouder of our New York City students and parents. Every single one of you have had to overcome obstacles that no one could have even imagined. But you all have met those obstacles by rising to the occasion and by finding new ways of being in community with friends and classmates. This year is not going to be easy. It is going to be a challenge. And being in school is going to look and it's going to feel a little bit different than what I think all of us are used to. But I want you to know that the community is here to help you, is here to support you, and all of us, myself and my office included, stand in unity to keep New York City families safe. I am going to ask that every single one of you continue to follow safety protocols and that you treat each other with kindness and compassion, okay? This is a very hard time. The interdependent nature of this virus of COVID-19 means that the only way we are going to get through this is together. So I want to extend my gratitude to North Central Bronx and to Jacobi Hospitals for putting on this event for New York City families and for their continued service and their dedication to all of you, to keeping all of you safe, to keeping all of you healthy, to keeping all of you informed as we enter this new and transformed school year.
Okay, thank you very much to Dr. Barayas and also to the two elected officials. One of the questions that came up on the chat, people were wondering where to register. We're going to be putting that up on the screen. And so there it is right now up on the screen. So you go right to that link and you'll be able to do that. Damaris, one of the things that is so important here, and I hear it all the time, working in the Bronx and on Bronx television, access to healthcare, access to healthcare. We are blessed and partially through this medium because Jacoby Medical Center and North Central Bronx, the doors are open. The importance of having access to healthcare cannot be understated. I'm sure you feel the same way.
100%, Gary. These are times where we can't play with our health, you know? We realize now more than ever how fragile we all are, regardless of age, regardless of medical history. We've seen people get COVID and pass on under very difficult circumstances. And this is, although we have been able to stabilize numbers in our area, this fight isn't over. So now more than ever, tener acceso a un médico, tener acceso a un hospital, poder hacerse la prueba de COVID-19 es algo demasiado importante que no podemos ignorar. Nuestras vidas solo la tenemos una vez. Tenemos este privilegio de estar en esta tierra, en este planeta hoy, pero tenemos que cuidarnos cada momento y más ahora con COVID-19.
I'm going to share a personal note that we talked about the other day. Everybody I know knows somebody who passed away or knows somebody who got sick, and I've seen it on Facebook and I've seen it on other social media. Do you know anybody? Well, unfortunately, my 91-year-old mom died of COVID, which is just horrible for us and our family. But I know there are so many people who share that. One of the things that is the antidote for that is information. And so, Damaris, I know you have a special guest that you want to introduce. Let's do that and get information.
That's right. And I want to express my condolences for your loss, Gary. In my family, we lost 3 relatives as well. And it's a story that so many people can tell since this pandemic came to our area. So we want to welcome now someone very special and very important, someone that's been at the forefront working hard towards fighting this disease that's come here to change our lives, our world. And I'm talking about Dr. Chichi Angayu. She's the Deputy Chief Medical Officer at NCB, and she's going to be taking questions from all of you. So we ask you to please engage, please participate. This is a platform that has been created for you. So let's please welcome Dr. Angayu.
Hi.
We'd like to have you with us.
Thank you so much for having me. On behalf of Jacoby and North Central Bronx Medical Centers, Jacoby is our tertiary center where it's a level 1 trauma center, and anyone who is sick or needing trauma care, that is the place to be. It also happens to have a burn unit, and it's a center of excellence for snake venom. And North Central Bronx is our community hospital where we have primary care for adults and peds, and we have a women's care center where the primary care is primarily given by midwives with collaboration with the physicians to give you your community OBGYN and women's health care in the communities you live in. Our testing center is available and accessible to the public, and we're developing service lines, including orthopedics, as Dr. Barras had mentioned. And here today, we're really excited as people are going back to school to talk to all of us about questions and concerns and some myths and truths and facts or fiction about COVID to make people feel more comfortable about what's going on and how to continue to keep themselves safe.
So can I start the ball rolling on the notion of myths? Did you want to add something to that?
Sure. No, go ahead.
So I wanted to ask me, because I hear this all the time, and then there's been back and forth about this, and that is, if you've had COVID and hopefully you have not had a hard time with it, but you've survived, can you still get it? And are you still a risk to others around you? Can you, I hate to even think, be even a little more careless about it? Should you wear a mask? I mean, what is the state of somebody who's already had it? and the danger that they present, or are they somewhat invulnerable?
I know that's like, that's like $1 million question. What we now know about COVID has changed over the last several months. When you have COVID, having the disease causes you to develop what we call antibodies, and that is something in your blood that helps protect you and keep you safe, just like if you had chicken pox or if you had measles. So your antibodies then put you in a situation where you're sort of kind of protected for it. What we're finding out is that over time, these antibodies wane. So if you've had COVID and you develop antibodies, during the time you have your antibodies, you're unable to get sick again, but you don't have antibodies forever. The duration of you having these antibodies vary in different people, so you could eventually become at risk to get it again. A lot of people who have COVID are not sick from it. That's why wearing the masks in the community helps prevent you from getting it and or giving it. And for a duration of the time after you have it, you're still kind of exposing others to the particulate matter as you speak or you're in close contact. So wearing your mask is definitely protective. At a time, this infectiousness as a person who has COVID wanes and you're no longer infectious. And to keep everyone safe, because we never know exactly how long that period lasts for an individual, you should wear your masks and should maintain your social distance. Eventually, you're no longer infectious, but that always takes a certain amount of time.
Sounds like caution is the order of the day. Damaris, did you want to ask a question there?
Yeah, we've heard a bunch of things about, the vaccine coming around and being tested in different places. And we're all holding our breath waiting for that light at the end of the tunnel. And I wanted to know, you have more information about this than we regular folk do. What do you think is going to happen? When can we expect to see something come here to our area? And should we be afraid?
I think that's something that is beautiful that's coming out of COVID, is that everyone is really targeted towards the goal, towards making everyone safe and how to create situations where there's no cure, but there's an improvement from the current status, and also developing a vaccine to help people to get immune. Currently, there's no available vaccine for coronavirus or COVID-19. There's a lot of research, however, that's ongoing to develop a safe and effective vaccine. As we know, anything that's good takes time. I'm happy to report that Jacoby and NCB is preparing and getting involved in some of the vaccine trials, where we'll be able to have a safe and effective way of rolling this out in a research milieu to determine, to have it's studied for safety, to make sure that before it's available, that we have as much information as we can get. This is a fact-gathering enterprise at this time, and I'm very hopeful and enthusiastic that at some point we'll have more information. But right now we don't, and it'll take a little bit.
I wanted to share a little bit of that in Spanish, because I think it's important.
Yes, please do.
So Gary, la pregunta de Gary fue que si ya le ha dado COVID, ¿cuáles son las precauciones que debe tomar la persona? Si ya se siente bien, anda por ahí en la comunidad, si es necesario usar el tapabocas. La doctora añade de que aunque te haya dado y tengas antibodies para el COVID, no quiere decir que estás completamente a salvo de volver a infectarte. Los antibodies no duran en el cuerpo para siempre, tienen su tiempo limitado. Entonces, por eso es demasiado importante mantener siempre el tapabocas, mantener la distancia, el distanciamiento social, mantener todas esas reglas para protegernos, porque si nos dio, nos puede volver a dar, y también vamos a exponer a nuestros seres queridos. Y lo de la vacuna, la vacuna, dice la doctora que están trabajando ahí en Jacobi, en el hospital, con un comité para tratar de hacer que este proceso se haga más rápido, ¿no? Y que llegue una cura a nuestra área, una vacuna a nuestra área, para que nuestros residentes puedan retomar sus actividades sin miedo.
Thank you so much. We just got a question from Jackie, and this is such a fascinating, I never would have thought of this. She said that her husband had COVID, hospitalized for 4 weeks. God bless him. He made it. I don't want to get choked up, but he did. And but he still has the side effects. Is it safe for him and even necessary for him to get a flu shot?
So that's a great question. That's a very good question. We're coming upon the flu season, and we want to try and make sure that people have as much immunity and protection against flu so they don't get sick or potentially be exposed to COVID and then get sick again from the flu. And so that's a double whammy, so to speak. If he doesn't have a contraindication for flu and if he's not acutely ill, the flu shot is a good thing to have. What we noticed in the with the virus is that a lot of people are affected in different ways. Unfortunately, those who were in the ICU, when you're in bed for a long time, you get, your muscles get weak and you will need to build back up. And even after you're recovering, the recovery period could take a long time. Before you're let out from the hospital, we're tested to see whether or not you're still actively shedding the virus, so you're clear on safety from that standpoint. And it takes a while to get yourself back to your normal baseline after having been discharged. If you're no longer acutely ill and you don't have a contraindication, the flu shot will be good to help you develop antibodies against flu so you don't get sick from the flu. And we are strongly encouraging the general population and high-risk people to get their flu shot for that reason.
Damaris, please do that.
Yeah, so Jeremiah has a question. Jeremías, gracias por enviarnos tu pregunta. Dice, tengo raspero en mi garganta, tenía COVID hace 5 meses, ¿qué puedo hacer? So he still feels, this discomfort in his throat. He had COVID 5 months ago and otherwise got better, but this situation is still happening in his throat and it's very uncomfortable. What can he do?
So a lot of times, and I don't know from this particular case if he was on the ventilator and how sick he had been. A lot of times if you had surgery and you had a tube down your throat, you're on a ventilator for a long amount of time, you do have some inherent irritation or damage to your vocal cords in your throat that takes time to normalize. I would say that give yourself time, follow your physician's instructions, and if you have any worsening symptoms, have that evaluated. Having one does not negate or prevent you from having something else. But oftentimes the long-term effects of having been hospitalized for a long period of time and or having issues regarding intubation or ventilator support could take an undetermined amount of time to normalize.
And how about just like, the regular symptoms, the cough, the sore throat, and still perhaps maybe he wasn't on a ventilator. Okay. What can they do? I've had friends also that say, wow, I still get aches. I still don't feel 100%. When I go out running, I feel like my lungs are like my chest is tight.
And, this is one of those things where this virus is just something that turns up differently in so many different people. It's really hard to predict how long you have symptoms and how long they last and or get better. There are a lot of different other things that are associated with having had coronavirus. Sometimes you could have it affect heart as a myocarditis. Sometimes you could have it affect your lungs, and it makes you feel like you have like asthma-like and, chest tightness. Each individual is different. There's no one set of symptoms that everyone has that lasts for a certain amount of time and gets better. The majority of people feel better within a few weeks. We're finding there are a lot of people who over time have ongoing chronic symptoms related to coronavirus. We don't know why. There is a huge amount of research that is ongoing, and we continue to learn with each and every patient. I would say keep in contact with your healthcare provider. Don't ignore your symptoms. Taking care of your health, making sure you get adequate rest, hydration, and sleep. Warm teas, keeping yourself hydrated is some of the best things that you can do as we continue to get to know more about what this whole pandemic is bringing to us.
Okay, I want to share that for Jeremías. La doctora recomienda los tés caliente, cuidarte ahora más que nunca, porque obviamente si tuviste COVID y todavía estás sintiendo algunas condiciones y luego te vuelves a enfermar, será peor, ¿no? Y obviamente si estabas en el hospital y estaba con los tubos, las personas que estaban intubadas van a sentir ese dolor, esa incomodidad en la garganta por mucho tiempo, mientras que el cuerpo se vuelve a fortalecer y a ponerse fuerte nuevamente. There's another question that, and I think this one is so important. How can we tell the difference between the flu and COVID? ¿Cómo puedo diferenciar entre COVID y el flu? I, for example, in the fall get allergies, right? So the moment I step outside my door, I start sneezing and sneezing and sneezing. So when I go somewhere and I'm wearing a mask and I'm like food shopping and I'm sneezing, people are looking at me like, why are you out of your house? But what can we do?
You may not know the difference. The difference is in testing. If you have symptoms of the flu, if you have a temperature, cough, runny nose, or, it's almost indistinguishable, which is why it's so important to do as much as you can to keep yourself healthy and have, preventative activities in place. It's literally almost impossible to tell them apart. And the thought is, even last year, when there was the surge in the flu, there could have been some people who had coronavirus. We just hadn't started testing at that time. So it's really important to get tested. I say get tested at any time you think you need to. Get tested often. Get tested early so that you can distinguish, and get your flu shots so you can protect yourself against the flu.
La importancia de tomar todas las precauciones para cuidar la salud ahora más que nunca, porque es un poquito difícil diferenciar el flu versus el COVID, pero el examen está disponible para todos los residentes del Bronx, para todo Nueva York, para toda la gente de nuestra área, así que hacerse la prueba de COVID-19 si siente que tiene alguno de los síntomas, porque obviamente los síntomas son muy parecidos, pero el tratamiento será un poco diferente, así que hacerse la prueba, cuidarse muchísimo, es lo que recomienda la doctora.
I want to expand a little bit on the notion of testing. We've gotten a couple of questions. Somebody was concerned about school. Do you test, should children and teachers and staff be tested before school? Somebody else asked, if I come in from another country and I'm going to extend that to another state, do I need to get tested? And then the bottom line, who should get tested? Should everybody say, you know what, especially if they do have a flu or an allergy and they're not sure what to do? And then, of course, I know that the NCB has tested 14,000 people recently. We have many more people in the Bronx. Are there enough tests? Can we get it all done? And of course, you don't want to test and wait a week. So testing, that's the question.
And how often too, doctor? How often should we get tested? Let's say I traveled to the Dominican Republic and I was in a beautiful beach resort and I come back and I get tested and I'm like, I'm good. But then my test results come 5-10 days later. And am I good? Like, where was I between when I landed here and I got my test results?
And, and that is what is trying to be shaken out by several different guidances that we've been given regarding travel. New York State has the travel advisory. So if you left New York and you went to any, let's stay local at this point, any state that was considered to have a higher prevalence of COVID than New York State, on your return, you're recommended first of all, you have to sign a disclosure on whether or not you have any symptoms, have you been exposed to anyone who had symptoms, you have a fever, and a list of your contacts during the time you were away. And then you, based on that, you're recommended either to get tested or to be quarantined if you have had exposure to someone who potentially could have been at risk. Now, if you're a healthcare worker, for healthcare workers, we like to see that if you at all have been in anywhere where you potentially could have been exposed, that you get screened or tested so you're safe for yourself and your patients. And in several areas of employment, depending on what the risk factors are in where you work, there's recommendation and protocols for you to get testing just to within 72 hours of having been exposed or within 72 hours of having left a certain area to somewhere that has a higher prevalence. For international travel, you have to have negative tests before you get on the plane. And when you get to where you're going, you have to have a negative test within your departure to show that you're negative at the time of leaving, so that there's not the movement of infected persons in between geographic areas. At best case scenario, it's still almost impossible to adequately assess risk and infectivity, because a lot of people, the majority, half, and sometimes up to 80% of people have no symptoms, and they're positive, and so in their normal functioning, they're exposing people who are near to them or in close contact to potentially receiving coronavirus. So these are all guiding principles, and so for the answer of who to test, anyone who has any degree of risk, any concern for symptoms, or any degree of exposure should get tested. Now, the beauty of testing is, as we go on, they're getting more and more types of testing that result in a shorter amount of time. Currently, in our testing units at Jacoby and North Central Bronx, we have a test that you should get the results within a couple of days, and that's pretty regular and available. There are some rapid tests, so if you need your test within a certain amount of time, in certain cases, like if you were sick, because we want to make sure that if you're ill, you go to an area and you're adequately separated from other people, so you're not spreading and you're not infectious to them. We can get the results within an hour or two. But in general, for people are testing, 2 days is the average amount of time of getting it turned around, and it's pretty reliable to that.
Before Damaris translates, and I want to just ask one more thing, where to get tested, because we have that center at Lehman College where you can drive right in. I've seen some of the local medical facilities, the City MD and those things, North Central Bronx. Does it matter where you get tested, and do you need an appointment? Like, I really want to navigate this because we really want people to have access to tests, and there's a question that just came up about accuracy. Let's just do that, and then Damaris, good luck. Try to summarize all this very important information.
We have a testing center. You can walk in. You don't need an appointment at North Central Bronx. Jacoby has a testing center also. Similarly, it's very easy to navigate. You walk in. The lines are never long because the flow goes very quickly. You get your specimen taken and you'll be informed of your results within a few days. So testing is available anywhere where you are. If you call 311, you'll be able to get information on a testing that is near your house. And both our hospitals, Jacoby Medical Center and North Central Bronx, have testing units that are open 7 days a week.
Dr. Aniago, let's let you conclude with a statement about school.
So, a lot of work and energy has gone into seeing that schools are opened in the safest way possible for the largest number of people who are willing to attend. I think that the current guidance and a lot of the engineering controls that have been into place are going to be very helpful. And it's really important for all of us as parents, as teachers, as students to understand that, to keep ourselves safe, we have to maintain the social distancing, wear the mask, wash your hands, and try to be as vigilant as possible as we navigate this new normal, and also continue to be able to develop the resilience to live our normal daily lives. Thank you for having me. We're open, Jacoby and North Central Bronx. We are available, and please call in for any more questions or concerns that you have. Thank you.
I know Damaris agrees with me. It's people like Dr. Aniago who are saving the Bronx. I mean, we need her desperately, and she showed up and did a great job today.
Yes.
Just a reminder, people can enter for the prizes. Apple iPads, Kindles, tablets, bikes, all these wonderful things. The way to enter is right there on your screen. And I think we're ready for the next segment. We will have Dr. Stephen Bloomberg from the Pediatric Emergency Department at Jacoby Hospital, State Senator Jamal Bailey, and I believe we're going to start off with the Speaker of the New York State Assembly, is Bronx Assembly Member Carl Hasty.
Así es, tenemos unos invitados muy especiales y les recordamos que pueden formar parte de la rifa de regalos, así que ahí tienen la información en la pantalla, tienen que aprovechar para que se lleven estos regalos que están espectaculares. Así vamos a ver estos mensajes ahora.
New York State Assembly Speaker Carl Hasty, and I want to thank North Central Bronx and the hospital that I was born in, Jacoby, for putting together this forum on having our children go back to school in a safe manner. Don't forget that we should wear our masks, socially distance, wash our hands, and use hand sanitizer. Remember, we all have to care for each other, look out for each other, and stay safe.
Hi there, I'm Steve Blumberg, and I'm the Associate Director of the Pediatric ER here at Jacobi. I'm going to talk a little bit about school safety and returning to school in the age of COVID. So as a pediatric ER doctor, I'm very excited that schools are opening up again and in-person learning is going to be happening. But I want everyone to be aware of some ways to minimize risk to the students, the families, and also our school staff. Fortunately, right now, COVID cases are low in the New York City and New York State region, and it allows schools to reopen. Unfortunately, we know that kids can transmit COVID, even if they're asymptomatic. Fortunately, kids don't get too sick usually from COVID, but they can. And if they have other illnesses like obesity or asthma or high blood pressure, they can get sick. The best ways to protect our kids are the things that you've heard about. And staying safe means wearing a mask. It means social distancing, staying 6 feet apart from one another. I know that's hard to do sometimes in the classroom and at home or out when they're outside. It means washing your hands frequently. And then finally, it also, as it relates to school, it means not going to school if you have any symptoms. So we can't be sending our kids to school if they have anything that could be related to COVID. Cough, fever, shortness of breath, nasal congestion, loss of taste or smell. New York City Health and Hospitals and the Department of Education have also issued guidelines in terms of what should be done if a child comes in contact with somebody who had COVID, or if they have COVID symptoms or test positive. So if they come in contact with somebody and are with them for more than 15 minutes, less than 6 feet apart, they would need to stay home from school for 14 days from when they saw that person, okay? And they would do remote learning. Likewise, if a child tests positive for COVID, they'll need to stay home for 10 days and can't return until their fever has been gone for at least over 24 hours and have stayed home for 10 days. It's important that kids get tested if they have any symptoms whatsoever. New York City Health and Hospitals has a lot of testing sites all across all the boroughs. Here at Jacobi, we have a site that's open Monday through Saturday. At NCB, there's a site that's open 7 days a week. But it's very important, and it'll help our teams, it'll help the schools make sure that we can keep our schools open. The other thing is it's important for kids to go back to their doctors and start to follow the routine of well visits, and also go back when they're not well. There's a lot of options within H&H between telemed, in-person visits at our clinics, our ERs, our urgy centers, and we're open, we are safe, we have good protocols in place to keep our families safe, but please go back, especially kids that are missing some of the immunizations. We need to get them back. And finally, it's really important that kids get their flu shot this year. Without question, we know that flu symptoms mimic COVID symptoms. It's going to be difficult for us to tell who has flu, who has COVID, and then the consequence of that and the quarantining that might be associated with that. And then also, we believe it's going to be very dangerous if somebody gets both COVID and flu at the same time. And if we can minimize flu, that would be wonderful for both our kids and our at-risk adults. So with that, I hope everybody has a great and safe school year.
Hey everybody, it's New York State Senator Jamal T. Bailey. I want to thank North Central Bronx Hospital and Jacobi Hospital for putting on this very important forum about back to school. Look, these are trying times. We don't know what's happening with COVID-19, and we have a lot of questions about what's happening inside our schools and also what's happening with remote learning. Utilize this forum as an opportunity to ask questions about what's going on. These are our public hospitals, and they're really good hospitals, and they're hospitals that take care of wellness, not just physical wellness, but mental wellness and family wellness. So look, we got to make sure we stay together at times, in trying times like this. It's critical that we do that. Wear a mask, wash your hands, and keep your social distance now so we can get together later. God bless, take care, happy back to school.
All right, thank you very much. Very useful information. Damaris, did you want to translate any of that into Spanish?
Yes, ahora es que las escuelas están abriendo y muchos niños están yendo a recibir su educación ahí, en persona, en las escuelas, tomar todas las precauciones. Si un niño se está quejando de algo, si no se siente bien, llevarlo al médico de una vez, llamar al doctor. si tiene síntomas de COVID, quedarse en casa por 10 días mínimo hasta que el niño se sienta bien. Entender que muchos niños son asintomáticos, que pueden tener COVID y que no están demostrando ninguna señal de que tienen el coronavirus. Así que mantener eso pendiente, especialmente cuando uno vive con una familia más grande, saber que los mayores, las personas de la tercera edad pueden ser más susceptibles si llega un niñito de la escuela que es asintomático con COVID-19, se puede complicar la cosa para toda la familia. Entonces, los niñitos que tienen asma, los que tengan alta presión o cualquier otra condición, saber de que ellos, aunque se dice que los niños pueden ser asintomáticos, los niños que tienen alguna condición médica pueden tener un problema más grave. Así que mantener las reglas del distanciamiento social también muy pendientes y muy presentes en sus vidas, que entiendan la importancia de ponerse su tapabocas en cada momento hasta que podamos verle la solución a este problema que tenemos en nuestro mundo.
Speaking of schools, by the way, while we do the next segment, if anybody wants to register for those prizes, please make sure to do so. But speaking of schools, we are going to welcome the DOE Executive Superintendent, Maisha Ross Porter, is with us. Ms. Porter, nice to have you with us. Thank you for joining us.
Thank you for having me.
There are so many concerns about schools. Parents are asking questions. Certainly the kids want to know, what am I doing? And you heard some of the dialogue here. Maybe you could tell us your vision as the executive superintendent for the Department of Education. Where are we at? What should parents know? What should children know? What should staff and teachers know?
Well, I want to first of all thank you all for putting this together, because I think we learned a lot from the medical professionals who spoke earlier. I'm really excited to welcome students back to school, both in person and those who are joining us remotely. And I think the most important thing that, our parents and students and teachers and everyone needs to know is that we must, if we want to be able to continue in-person learning, follow the COVID-19 guidelines, which we've been doing in our regular lives while we've lived remotely, but we now have to do in school. And I've had the pleasure to visit many schools and to see our students and staff members in masks. Our custodians have worked really hard to keep our buildings clean and get them ready for students walking in. There's tons of PPE, hand sanitizer around the building, ensuring social distancing. And so the most important thing we must do first is, kind of live by those guidelines that we've been living in our regular lives, and now apply those guidelines to school.
Do you have any concerns? Are there? I mean, I know you're responsible for a lot here. What's on in your mind that you says, boy, we've got to get this done? Explain to me what you're thinking about.
Well, I'm also a parent of a student who's going back to school. So I definitely understand all of the worries and concerns. And so I think we have to get two things done. And just what I said, we have to make sure that those COVID guidelines are a part of our school life. And in addition, we have to build up our muscle as educators to operate in the remote environment. We switched very quickly in March to remote learning. And so now we have to build that muscle, because the thing I think about the most is the moment that we are in right now, and how are we leveraging technology to transform education, and what it will be once COVID is over, and how much we will have learned, and how much education will be different. And so that's the thing I'm thinking the most about, because I can tell you, our teachers, our principals are really doing the work to make sure that those guidelines are in place in schools. But now I think what the parents want to know, in addition to the health and wellness of their children, they want to know, I want my children learning, and I want to know what that looks like.
Mm-hmm. Damaris, did you want to ask something? If not, I'll do a follow-up.
You know what I do want to is translate that a bit, because I think that's going to bring a lot of ease, to a lot of parents that are so concerned about that in-person, training and schooling now. Que nos dice la Superintendent, nuestra invitada especial en el día de hoy, que en las escuelas están tomando todas las reglas y las precauciones necesarias para proteger a sus hijos, tanto como también a los profesores y todos los que entran al edificio, porque Solo de esa manera pueden evitar que se siga propagando el coronavirus y están tomando todas las medidas. Y también como madre, ella está, aparte de ser toda una profesional administradora en la escuela, también es madre. Entonces le toca las dos tareas. Saber qué ha significado esto para los niños desde marzo, estar estudiando en casa de manera virtual, haciendo sus tareas de manera virtual, aprendiendo qué le está haciendo eso al cerebro de los niños, cómo vamos a entrenar nuevamente este músculo para que los niños, si tienen que seguir aprendiendo de esta manera virtual o si vamos a regresar a la escuela, qué significa eso para los hijos. Entonces, es muy importante el tema y muy dichosos de poder contar con ella en el día de hoy.
Thank you very much. We're getting a couple of questions about individual schools. The system is just so vast. It's so hard to, generalize and say we're doing this because every school is different. Let's see, it's Stephanie who said that Morris High School still doesn't have a nurse. Other schools are concerned because they've heard about staff members or teachers who have tested positive. How do we sort that out? Frankly, you have my sympathy. I don't know how you'd sort it out, but I'm curious about the DOE's perspective on that.
Yeah, so I'm also watching the chat too, and so I wrote down that Morris High School question. And
Good.
The DOE is working to make sure that there's a nurse in every school because we know how important that is. But we also are very clear about our test and trace protocols. And so we opened last week and we had a couple of positive cases that popped up in the Bronx and we immediately closed the buildings. One case leads to tracing leads to the test and trace protocol to identify who's been exposed. 2 cases will ultimately lead to a school closure. And we've done that twice already because we know 2 things. We know we have to keep our building safe. We know we have to monitor these cases, but we also know that there are students who need in-person learning. And so we have to continue to monitor the cases to ensure that happens. We also have we are also doing wellness checks as students enter the building, as every adult enters the building every day, myself included. And so some folks can do it online and show it to the safety officer. And if they can't, it'll be done in person. And so we know how important it is to check it on the health and wellness of folks as they enter the building. And like the doctor said, and I make a joke of this because I was definitely and have always been the parent that said, you got a little cold, you'll be fine, go to school, right? That is no longer our advice. You got a cold, you stay home because we don't know what symptoms are what. And so we're asking everyone to please, if you don't feel well, to stay at home.
Wow, that's wonderful. Para las personas que han preguntado que si sus hijos serán castigados o tendrán algún efecto negativo o quedarse en casa estudiando versus ir a la escuela, es que las escuelas también están apoyando a cada uno de esos estudiantes que con sus familias han decidido quedarse en casa para proteger a todos los demás y seguir estudiando de manera virtual. Todos esos programas, así, ya sea culinarios, de los niños que están en escuelas vocacionales que tienen que estar demostrando cierto talento, cierta capacidad, todo eso también se está haciendo de manera virtual y se les está dando el apoyo necesario para que ellos sigan creciendo y aprendiendo en cada momento.
Just looking at the whole situation, so many questions. I mean, we don't have near enough time to get to everything that people are asking. If you have a concern about safety specifically regarding COVID in a school, what do you do? Who do you talk to? How do you find somebody to get an answer from? Sometimes it's hard to do that under general circumstances, but this, of course, is literally life and death. How do we deal with that?
So if you suspect for yourself or you've heard, you should report that to your principal right away.
The principal.
Yes. Obviously, we are not revealing people's personal medical history. However, if there is a suspected case in a building, we send it downtown to what we call our situation room. They evaluate the case and we immediately notify the community. If it's a confirmed, so we notify of a potential case, we notify of a confirmed case, and we notify if there are multiple confirmed cases. And in addition, we work with the Department of Health Test and Trace Corp to identify people who may have been impacted by the potential case or the potential positive case.
Thank you very much, Maisha Ross Porter. This has been incredibly valuable. As I said, we could be here for 2 hours and not
Yes.
get enough questions because we really care about our families and our kids and our schools. Damaris, you want to conclude that?
No,
Okay.
thank you. Thank you so much for taking the time to address the people from the Bronx and everyone that's tuned in. It's such an honor to be able to count on your expertise and your experience and this time that you're sharing with us.
Thank you so much.
Thank you.
Folks, we just want to remind you, we're still open for raffles and for prizes. As I mentioned, Apple iPads, Kindles, tablets, bikes, bicycles. Wouldn't that be nice? What a great way to spend your COVID time is riding bicycles. All these things you can register, and we've been putting up the information of where you can register on the screen. One of the things that has come up consistently in healthcare in the Bronx and frankly, everywhere is access to health insurance. Some people had asked about costs for some of the services. There are two very, very good insurance companies that they work with. I understand they're going to be putting them on the screen. But if you're concerned because you don't have insurance or you need to have insurance, or you're concerned about the adequacy of your insurance, please reach out and make that happen. I think that we're ready for the next segment. I want to just make sure I introduce it.
In New York City, we believe everyone deserves affordable health care, no matter how much money you make or where you were born. That's why we created NYC Care. This program helps you get health care at little or no cost. NYC Care is not health insurance, so you don't need to worry about monthly payments. And it's free to join. Once you join, you'll get your own primary care doctor, low-cost prescription medication, and specialty services. Are you ready to unlock your right to healthcare with dignity and respect? Visit our website or call us to get started today.
¿No calificas para ningún seguro médico? NYC Care es la llave que te garantiza acceso a servicios de atención médica de bajo costo o gratis, ofrecidos por la red de hospitales y clínicas públicas de la ciudad. Aprende más en nyccare.nyc.
Hi, this is New York City Councilman Mark Jonai. I hope you and your family are doing well during this pandemic. As we're preparing to go back to school, whether your child is learning remotely or through blended instruction, I want to wish all of our students a healthy and successful school year. Back to school season creates a rush of emotions for so many of us. It is back to waking up early, packing lunches, and getting homework done. Although this year will be different from the rest, I know that with some patience, caution, and dedication, our students will get through the school year safely. Reminding you to wear your mask, social distance when possible, and wash your hands frequently. And to our wonderful educators and school staff, I thank you for your continued support during these difficult times and for the hard work year in and year out. Lastly, I want to thank Jacoby and North Central Hospital for putting together this back-to-school event and bringing our community together for an informative forum. Best of luck in the upcoming school year.
And Damaris, thank you. It's just been such a pleasure to have you and be able to provide information that I can't provide. And I think what we're going to do is we're going to conclude our program appropriately. First of all, we want to thank all the participants. We want to thank Jacoby Medical Center, North Central Bronx Hospital, the doctors, all the elected officials, and everybody who participated. Let us now conclude our program with remarks from Christina Contreras, who is the director of North Central Bronx Hospital. So we'll see you all around. I know that Damaris wishes you all safety and well. I do the same. BronxNet Television and Univision feels the same way. But now let's say goodbye with Christina Contreras.
I would like to thank the entire team that worked on our very first virtual health fair for Jacoby and NCB, especially our wonderful host and our guests. I also want to acknowledge our sponsors for helping with the prizes and giveaways for you. We're very grateful to our elected officials who partner with us and play an important role in helping us extend quality health care to the communities we serve. Together, Jacoby and North Central Bronx serve a large community of patients. Each year, we have over 285,000 clinic visits, 4,700 surgical procedures, over 20,000 admissions, and more than 100,000 emergency visits. We are very proud to serve the Bronx and look forward to further engage with our community and welcome you back to our facility to receive the medical service you need. Thank you so much for participating today and spending some time with us. We are very appreciative. Congratulations to all the winners. We at Jacoby and North Central Bronx are here to serve you and empower you as a community to live your healthiest life. Thank you, and I look forward to seeing you all in our facilities. Stay healthy. God bless.